Good morning, ladies and gentlemen. We are the Group 2 and we will discuss the overview of Health Informatics, Health Information System for Medical Technologists. Here are the members: Judy Anabul, Romel Baloro, Jenny Rose Lorenzo, Charlene Mansili, Janine Mariano, Pia Monique Palteng, Rochelle May Rondon, Jessica Rosales, Regine Teja, and Soriano Jamaica. Now let's proceed to the first topic.
For the objectives, the first one, understand the value of data-driven decision-making and its application. The second one, differentiate the various terminologies of health informatics. The third one, discuss the application and significance of health information systems. Fourth, describe the status of health informatics in the Philippines. And last but not the least, ability to interpret and decipher the information found in the COVID-19 tracking system. So, what is health informatics and information technology? It is the methods and systems for the acquisition, processing, and interpretation of patient data with the help of knowledge from scientific research. It is all the aspects of the generation, handling, communication, storage, retrieval, management, analysis discovery, synthesis of data, information, and knowledge in the entire scope of healthcare.
And for the information management and health informatics, health information management focuses on the management of personal health information within healthcare organizations, including billing, coding, data governance security, record keeping, regulatory compliance, and patient privacy. And for the health informatics focuses on using current and emerging information technology systems to leverage the data proceed through health information management to create knowledge that can be used to boost efficiency, reduce costs, and ultimately to improve patient outcomes. And for the terminologies, health information technology. It refers to electronics uses to store, share, and analyze health information. And health information systems. It is a system which integrates collection of data, do processing, reports, and use the information for health services, for example, the electronic health record. And for the application of health information system on public health, it is a data collection by HIS which utilized by health planners and decision makers to facilitate a better health services. Hindi yung hula or feeling mo lang na tama yun at yun ang dapat gawin, but it should be relevant and based on the data that have been gathered. There are 6 data to be collected by HIS so they can decide. First, the health determinants. This is the factors which affect our health. Example, the risk factors, lifestyle, your age, sex, health history, and more. Contextual and environment. For example, right now we experience pandemic, which all people should be careful and use masks, social distancing, and sanitation. Second, shortage of resources. So we should prioritize where we use or place them, or kumbaga, dapat pag-isipan nating mabuti kung saan natin ito gagamitin. Third, performance or output of the health system. Health outcomes. To assess health outcomes, we should monitor the mortality, morbidity, health status, outbreaks, and disability. And to improve health, we should know the different barriers in health, know who has access of facilities. In a certain area, we should gather who are in prone in, with any diseases. And lastly, these are the factors affect our health, the sex, socioeconomic status, ethnic group, and geographic location.
So there are two health information data sources, the population-based and the institution-based. In population-based, this focuses in population to the broader group of people. We get data from surveys, civil registration, and census. In institution-based, these are the data that we acquired from facilities and institutions. Example are individual record, service records, and resource records. And these come from schools, hospitals, and from various clinics.
So for the impact of a good health information system, it brings together all relevant partners to ensure that users of health information have access to reliable, authoritative, usable, understandable, comparative data, which will result to a more responsive and equitable health system. It is useful in policymaking and decision-making of health institutions and becomes the basis of, number one, creating program action, translate to efficient resource allocation at the policy level, enhancing quality, improvement of effectiveness of health at the delivered level. A good health information system serves broader objectives such as providing an alert and early warning capability, supporting patient and health facility management, enabling planning, underpinning, and stimulating research, and permitting health situation management. In addition to being essential for monitoring and evaluation.
Next is the health information management in the Philippines. Challenges in the HIM in the Philippines. First is integrating and harmonizing all existing health-related information systems and data sources. Next is inadequacy of a governance structure on information and communication technology or the ICT for the health sector. So there is a challenge on integrating and harmonizing all existing health-related information. There is a challenge in harmonizing in this health data. To make it more understandable, it should be presented in one single system. So coming from different devices and different sources, so there is a difficulty in integrating and emerging all these data. Number three is lack of plantilla position for system development, maintenance, and technical support. Actually, guys, they are the DOA uh, since 2011. They actually making governance structure, but there's still a room for improvement. Number four is poor data quality. Next is lack of standards on interoperability and data sharing, difficulty in reporting timely and relevant information. So they need to be hiring more information communication technology apparently the data quality because it's poor and lack of standards on interoperability. The cloud or Google Drive those anything that you will store in the cloud or Google Drive. So whatever decide that you will use, you can access. However, it does not the case with the DOH. The health information system, the health information system, there is a lack of interoperability, so it's difficult to access when you use other devices. The next is low utilization of health information and weakness in data analysis. So there is still need to be room for improving the culture of health information used by Filipinos. So it needs to depend on the health information system and weakness and data analysis. So that is for the challenges in HIM in the Philippines.
So let us move on the opportunities in the HIM in the Philippines. So the first one, recognition and adoption of EA to enhance ICT in the DOH. Second one, emerging technologies to automate or support business processes or the continuing upgrade. And the last one, move towards system harmonization and or interoperability.
Okay, next, the DOH Enterprise Architecture or DOHEA. So what is DOHEA? So this is a branch of DOH where they focus on management of the information from the coming in health sectors. So this describes the strategies for the aligning the business and informations and communication technology or ICT and its underlying infrastructure. And also it collections of data based on the standard sets, indicators, the storage of the data from various sources into the single data store or warehouse, and the consolidations, analysis, and provisions of report in an integrated system. And also, it assess information needs of other health sectors group and the importance of sharing information among various agencies. So in summary, these sectors of DOH, they collect data, store, consolidate, and they assess the information need and share the information need to the other agency. And these are the sectors that manage the health informatics.
So let us now proceed for the objectives of DOH Enterprise Architecture. The first one is to facilitate consolidation of systems and architecture. For the second one, promote interoperability by providing a means for communication and coordination of electronic data among the various health domains. So communication is indeed one of the essential or focal points for this objective. By means of communication, you are not just simply gaining knowledge, but also can provide learnings for others as well. So this also serves as reference in development of integrated information systems. It increases accountability and ownership of data and information. So basically, it gives everyone the right to secrete every information of a certain individual that is related. Harmonize and optimize processes and workflows to achieve integrated healthcare. This is to construct unity among the members for the greater cause of the said institute. And lastly, this is to promote the use of standards to support the objectives of the department.
Next is for the e-health in the Philippines. So in its broadest sense, e-health is concerned with improving the flow of information through electronic means to support and facilitate the delivery of quality and responsive health services and better management of health system and service delivery networks. It is envisioned that by 2020, e-health will enable widespread access to healthcare services, health information, and securely shared and exchange clients' information in support to a safer quality healthcare, more equitable and responsive health system for all the Filipino people by transforming the way information is used to plan, manage, deliver, and monitor health services.
Now let's move on to the sample health information systems in the Philippines. So the first one is the HOMIS or the Hospital Operations and Management System. Hospital Operations and Management Information System is a Windows-based computerized hospital information system for government hospitals which encompasses the patient's medical records. It is a public health information system that puts standard operating procedures in place that will systematically collect, process, generate, and share data or information to facilitate and improve patient delivery services. This is one of the best practices our hospital has to offer, for it represents a quantum of leap forward in legibility and the ability to rapidly retrieve information. Through it, it is much easier to retrieve and track patient data using patient registries than to use labor-intensive paper chart reviews. By this, nurses will no longer struggle in repeatedly opening a still chart, and in the same way, there is only a lesser chance of losing lab results because all were recorded. This innovation our hospital has allowed easy navigation through the entire laboratory results of a patient. Instead of pulling a chart to search for a lab result, it is simply a matter of a few mouse clicks, and in addition, the record is available 24 hours a day and 7 days a week.
Now, second is the clinical information system. A clinical information system is an information system designed specifically for use in the critical care environment, such as in the intensive care unit. It can network with many computer systems in a modern hospital, such as pathology and radiology. It draws information from all these systems into an electronic patient record, which clinicians can see the patient's bedside. CIS can benefit both patients and clinicians by improving communication between the many health professionals caring for each patient, providing all the information to the clinicians need to make good decisions and making it easier for patients to have x-rays and scans when needed. Also encouraging quality improvement and allowing better clinical research.
So for the third one, the Community Health Information Tracking System, or the CHITS. It is a low-cost, open-source electronic medical record, or what we call the EMR system, designed and developed for government health facilities. This system facilitates the responsiveness of health or the public health decision making and the improvement of effectiveness and efficiency of the delivery of healthcare services by the local government units, or the LGUs. And the fourth one, the Philippine Integrated Disease Surveillance System and Response. Surveillance focal points at the local and national levels collaborate with epidemic response committees at each level to plan relevant public health response actions and actively seek opportunities for combining resources. Surveillance data provide information which can be used for priority setting, policy decisions, planning, implementation, resource mobilization and allocation, prediction, and early detection of epidemics.
Ito pa rin dyan, sa four. Ay, ito. Now, for the Health Emergency Preparedness and Response Information System, informatics is not only used in hospital but also in disaster response. It can be used in tracking victims, electronic health records, supply inventory and surveillance of threat detection. Also, it helps in informing the volunteers about the plans and reports. We don't know when these calamities and disasters strike, but we need to be ready. We don't want to repeat what happened in the past, wherein many people died and lost their loved ones and well as their properties that they work hard. Having the informatics in emergency planning and responses is a big help in our people because it can help in giving status and reports that can warn them of an upcoming typhoon or other disasters. And last is the COVID-19 tracker. The Department of Health of the Philippines launched its new COVID-19 tracker. The revamped tracker features additional information on the epidemiology of the COVID-19 in the country, COVID-19 testing, health facilities, and availability of personal protective equipment. The public can now view data on the laboratory testing capacities of the DOH accredited laboratories, including the total number of tests, and unique individuals tested. And the public can now also have snapshot of the country's health system's capacity in responding to the pandemic based on data collected from the DOH Data Collect application. Thank you for listening, and that's all for our discussion.